Hello, I'm Dr. Mazhar Hussain and welcome to our part 3 in my blood tests are normal but I feel like crap. A lot of patients go to their doctors because they're not feeling well, maybe they're gaining weight, brain fog, tired, not sleeping well, and they can't focus, maybe depressive, maybe the sex drive is down, maybe they've developed some skin issues, maybe they got acne, maybe they're itching, maybe things are just not right. They go to the doctor is very cooperative, runs tons of tests and then comes back to the patient and says, look, I've looked into everything possible, but everything is fine and it might be in your mind maybe, or just let's see, wait and see, come back to me if it gets any worse. And the patient is really not feeling well and is frustrated. How can everything be normal if I'm feeling the way I am? So that's a very frustrating situation for the patient and in many cases also for most doctors, because they do really want to help their patients. But we need to understand what are normal values if we want to help our patients. So this is part 3. In the first video I discussed certain aspects of normal values, why we cannot use those normal values. We talked about normal blood glucose levels, we talked about thyroid stimulating hormone and testosterone in men. In the second video we discussed why certain criteria for normal values are not okay. We exemplified it with vitamin D and ferritin, why those blood test reference ranges are not acceptable and they're not optimal, and how we should look into for instance vitamin D and iron if we want to understand if the body has a sufficiency of these. In this video we are going to talk about another aspect of normal values. Of course this video is only for educational purposes. If you have any health condition, you need to speak to your healthcare professional. You should not act on anything you see on this video. It is purely for educational and informational purposes. So in the second part, we discussed the vitamin D, what role it plays in our body, and the criteria for vitamin D, whether it's useful or not. Likewise, we discussed whether the criteria for sufficiency in ferritin is useful or not. In this video, we are going to talk about the 95% mantra, when we say that a normal value covers 95% of the population that we studied. All right. So in many cases, we would say that normal value is 95% of the studied population that we then presume is healthy. But this is a statistical concept. It's not a medical concept. We do not really have any medical criteria that says that 95% has to be the right number that we are working with. It's something we have taken from statistics and applied into medicine. The normal values may, but does not usually account for what is healthy. You may be within normal ranges, but it doesn't mean that you are healthy then. It's a purely frequency perspective and not from a health perspective. For instance, more than 70% of Americans are overweight or obese. In that way, in the frequency aspect, being overweight or being obese is normal, simply because a lot of people are obese or overweight. It doesn't mean it's healthy. It can be quite unhealthy, really. And the 95% mantra, there are different ways to use that. We might say that, okay, patients that come in for disease that is not related to the kidneys, presumably, we might say, okay, let's take all their blood tests for the kidney. They come for high blood pressure, maybe they come for erectile dysfunction, or maybe they're coming for fatty liver or something else. We might then say that, okay, we'll take all of these patients that presumably don't have kidney disease and say all of their tests, 95%, the middle 95% represents the normal range. We might also just take a population and take their tests and say, okay, 95%, if they do not have any known disease, if they don't have any diagnosis, and we have a sample of patients, we put them a number of questions, we ask them if they're known to have any disease, and if they're not, then we'll just say, okay, we are drawing your blood and we're using that as part of the reference range, and the 95% in the middle we'll consider to be normal. We can also just say that if 95% of presumably healthy patients, patients that are asymptomatic or are not known to have a disease, it could be the normal ranges, depending on how the study is done. But these are the kind of ways we look at it. We try to find the 95% and try to account for some deviation. That is assuming that the blood tests would be following a normal distribution. And that's a continuous set of data with a symmetric distribution. And what we then do is we take out the extreme 2.5 in the lower end and in the higher end, cut it off and say the middle 95% is then our normal values. And it has a characteristic bell shape. So let's look into that. So we do these tests, we have all these patients, we have all this data, and from the lowest to the highest range we have the values here. And what we then say is, okay, we assume it's a normal distribution, it's symmetrical around the mean, and we said we cut off 2.5% in the lower end. There are outliers, we said we can't use those, and we take off the 2.5% above at the high end. And the middle 95% is then our normal ranges. You can also say it in a different way. If you look at a normal distribution, this is the mean. One standard deviation covers 68.2% of the population, and two standard deviations would cover 95.5% of the population. So from here to here, this will then become our normal value. The question is, why should we use 2 standard deviations? Why are we not using 3 standard deviations? Why are we not using 0.5 standard deviation and saying that health lies within this area? Or why are we not using maybe 1 standard deviation and say this is the health criteria? If you are optimal, you need to be in this range. Why do we include this? I'm not saying one is better than the other. I'm just questioning, how do we reach this number that 95% of a studied population is presumed to be healthy? How is that even possible? Is that really, does that really reflect health in our population? Is it likely to reflect health in our population? I believe it's not. Now let's take some theoretical numbers. These are not real numbers. I'm just trying to illustrate the purpose. Say if in the early 1900, if the average weight was in a society was 69 kilos, with a 95% reference range or 95% interval of 62 to 76 kilos. Well, then this would be our normal ranges. Now, we know for the past 100 years we have gained a lot of weight, and now say in 2030, if the same population, people in the same society, the same community, now has an average weight of 84 kilos, with the 95% covering 74 to 94 kilos. Should we then just say, well, okay, now we have a population, the weight is now 84 kilos, and this is then the normal weight. So if you lie within that weight, you're fine. Is that really so? Are you equally healthy whether you're 74 kilos or 94 kilos? For whatever height you have, doesn't matter. We're just saying, well, okay, you need to be within the 95%. We know from tons of studies that higher weight is associated with insulin resistance, is associated with diabetes, a spelling mistake here, cardiovascular disease, migraines, dementia, hypertension, depression, anxiety, fatty liver disease, it's associated with sexual problems, it's associated with Alzheimer's, it's associated with cancers. We know that. And why don't we use health criteria rather than the frequency, which we actually do? We do say, well, we can't just say that just because 95% of the population has this weight, we'll accept it as being good and optimal and healthy. We do not actually do that. So the question is, why do we accept 95% of lab values to be acceptable, to be the normal ranges, while for weight, we will say, no, you can't just be amongst 95% of the population that are not known to have any disease or condition. Why is it that we say this is not acceptable with weight, but it's acceptable for lab values? Being within 95% of the population's value does not make you healthy, as 95% of the population is not healthy. You could take another example. If your income is within 95% of the population, it says exactly nothing about your financial status, your needs, or your status. You may not be able to afford very basic things. And within the 95%, you might have 2, 3, 4 cars, 2 houses, and going on very expensive vacations and still be within the 95%. If you have shoe sizes, well, 95% of the population may have shoe sizes of 35 to 45. But does that mean any shoe between 35 to 45 should fit you? If you are within the normal ranges, that shoe should fit you. Maybe exactly 43 is fitting your feet, and maybe 39 is not. So, although it's 95% of the population, it does not mean it's the right thing for you. So, this was our third part on my blood tests are normal, but I feel like crap. It's very important when we look into normal values, we try to understand whether they reflect health or not, and we should work with optimal values rather than using normal values covering 95% of the population, or using health criteria that do not look into the complete role that any given blood tests play in our health. Thank you for watching this video. Do share it with your friends and family. Do like it and subscribe to our channel, and see you in the next video. Thank you.